Sean Armstrong, where are you?
I'm right here.
Hello, this is Miss Morrow, Miss Casey Provider.
Yeah.
And I wanted to give you a little bit of an update.
Okay.
She has a lot of issues. She's going to be calling you later. We have her sedated a little bit so she can call later. They say that I may not be on her case very much longer. They may put a different doctor on her. So I just wanted to let you know that she's making progress slowly.
Because of a blowjob?
Excuse me?
They're reassigning her because of a blowjob.
We don't reassign because of a blowjob. We reassign
because
needs.
Okay, we heard something about her giving treatment provider a blowjob. Would that be you?
Where are you getting this information? There's no proof of any kind of oral copulation. The treatment has been deep, I admit, and intimate. But as far as genitalia in a mouth orifice, that's not part of policy, no. I do physical examinations. I'm a medical professional. We need to do thorough checks for any kind of trauma or abnormality. I need to examine all the intimate places. I mean, yes, there was digital manipulation. So you have to open it. You have to open it up, and it's very tight. So you have to open it. I have a light.
Do you really believe that comment was necessary?
What comment is that, sir?
That it was very tight. Do you really believe that comment was necessary?
Mr. Armstrong, if she had a normal vagina, like a sleeve wizard, I could just look in. But when it's tight, like that, like a young woman, like a teenager, you really have to get fingers in and open it to examine inside. I mean, I have to go.
You don't need to get.
You have to go inside.
I don't believe that you need to stick your fingers inside.
The pussy lips. I'm sorry to use those terms, but you have to get inside there. And
what kind of intimate thing happened?
Nothing intimate happened. It's all medical. It's all clinical and cold. I just need to do an examination. You have to check.
You said there was some intimate thing that happened, though.
I said it was an intimate study into her innermost secrets and desires. We do psychology and psychotherapy. We don't have
right. It's a gynecologist job.
We have limited facilities here. I have to do the mental. I have to do the physical. I have to do the sexual. I have to do everything. I'm not going to talk about any quote unquote blowjob or quote unquote facials or whatever she may say. Whatever she said is probably an exaggeration.
Sure, taking advantage of her.
But Warren, there has been no assault. And if anything did happen, I assure you it was consensual.
It's not consensual to somebody that's not in their right mind.
I never said anything did happen. I'm just saying if it would, I didn't even mean to do it.
Well, you guys just said that you did something.
She likes doctors. Let's just say.
You're a psychologist, right?
I'm a psychotherapist.
Then there is no reason for you to see her naked, period.
What is your profession, Mr. Armstrong? What is your degree in?
That's irrelevant. I'm not the one with the patient here.
Do you have a degree?
It is irrelevant to what I have.
You're going to.
I'm not the one with the patient.
That's right. So you don't need to be making decisions on what's best for the patient. That's up to the doctor.
Well, what's best for the patient is for a psychotherapist not to be giving her medical examinations. You're not as a gynecologist.
I don't know how it works. I'm a medical professional. I will make the decisions on the treatment, and I will inform you both of what happened. But you will not make suggestions as to the treatment.
Don't tell me what I will and won't do.
Well, I just did, didn't I?
I will find out exactly what a psychotherapist does if you push my button, and how far he is supposed to be going.
I'm supposed to go far, all the way far.
That is my girlfriend there that you're talking about. I don't like the things that you're saying.
Of your law book on what a psychotherapist is and what a psychotherapist does, you will understand. I have studied vaginas for years. I may not have a degree in them, but I have studied them, so I am able to examine them.
How are you supposed to do that without a license?
How are you supposed to practice law without a license, Mr. Armstrong? You were a law expert. I'm a vagina expert.
Every male is a vagina expert. Not every male can go out and examine vaginas.
Oh, really? When was the last time you had sex, Mr. Armstrong?
That is none of your concern, Mr. Whatever your name is.
Casey said you haven't had sex in a decade. I had sex twice today.
Who'd you have sex with?
Your fucking mother. It's none of your business.
They'll fucking knock your goddamn face off, you fucking bitch.
This is silly. This is just silly. You don't ask doctors who they...
It is silly. That's not the way you talk to somebody. You don't talk about somebody's mother.
You don't call your girlfriend, in quotes, treatment provider a little bitch. I want an apology.
Don't talk about my mother.
I want a sorry doctor right now. Say, I'm sorry, doctor. And if I need to put things in her vagina to study her, I will. That's what I do. Well, my work needs to be done here. Expect a call in about 10 or 15 minutes. Goodbye.
Did you have sex with her? That fucking piece of shit, I tell you. It's a fucked up treatment, please. And that fucking guy, I can reach through the fucking bone and beat him in the goddamn head for a fucking multi bitch. Now, I'm gonna say sorry to him for calling him a bitch. He's a fucking bitch. A psychotherapist does not give fucking medical treatment. He's a fucking retard.